Hi, this is Dr. Warren. I want to share a little bit of information about computer lenses, how they work for patients, and how they can benefit many people. Computer vision, the demands of using a computer, it's not so much the fact you're looking at a screen itself, but it's the distance at which you're viewing the screen. It's typically further away than your normal reading position, yet not as far away as distance tasks that you might normally do. There are a lot of variables involved when looking at how patients use computers. The first would be the viewing distance. Are you using multiple screens at different distances, or is the monitor close to you or further away from you? Those all impact the design of the lens that works the best for you. Also, screen size. The larger the screen, typically the larger the text on the screen, the easier it is to see. Um, and also, a lot of times, the further away it is from you, if it's a larger screen, you're able to function with it further away. And then also, how are you using the computer? Are you doing a task such as data entry where you're taking information from a written list and entering into the computer? Are you doing data review or image review where you're really just working at the monitor and that's where your focus is most of the time you use the computer? Or are you multitasking at your desk where you're maybe doing all of the above as well as other tasks on your desk, drawing, whatever else it might be that you're doing, printing statements, reviewing them, all those sort of things. So the way in which you use the computer also impacts your vision demands at that computer. When we talk about different types of lenses, the most common lens people think of is a reader or a single vision lens, and they work very well for one distance. If all you really do all day long is look at the monitor and nowhere else, a single vision lens will work pretty well. But when you need multiple focal points or focal distances to work at, they certainly have a lot of limitations and may cause you to have to physically move materials back and forth or yourself back and forth to get them at the right focal distance. The screens and keyboards, for example, if you need the help to focus on the screen and the keyboard, a single vision lens may or may not do that for you. Or going back and forth doing data entry, looking at printed material and the screen. Or if using multiple screens where one is maybe straight ahead of you and then one or more screens are off to the right and the left and either closer or further away from you. So a lot of patients will use a multifocal lens. When we think of a bifocal, it just has distance and near, and it's probably the worst suited lens for a person using the computer over the age of 45 or 46 because of the lack of inherent natural focusing ability. But as you'd think, a multifocal lens lets you see different distances, and many people use a standard progressive lens very, very functionally for very, very many things, where the upper part of the lens is for the distance, the lower part is for reading, and the intermediate part is for your computer. As you can see on the left side under the normal progressive lens, that intermediate zone is awfully narrow. A computer design lens has most of the lens dedicated for using the computer and then the lower portion for reading, so there's a change in power getting stronger. So that if you're doing data entry, for example, you see the screen very well through most of the lens, and as you naturally look down to see the material you're taking information from, you can then see that with the lower part of the lens. And this allows for a much, much wider field of view at that intermediate zone, which is what you really need at the computer, and prevents you from having to tip your head up or use the lower part of the lens to view the computer itself, which can lead to neck aches and other ergonomic problems. So within the computer lenses, there are even subcategories of computer lenses, and this is why I'll spend some time talking to patients to find out just how they use their eyes at their office. The lenses we use the most, the ID series, there's the space, screen, and zoom. And screen is the lens for most of my patients that utilize a computer, but those that have multiple monitors or have other requirements further away from them might benefit from the ID space. Or if they really don't need a lot of flexibility in their focal range, the ID zoom sometimes helps patients work better. So depending on how you're using the computer and what your visual tasks are, we'll actually tailor the lens that we use within the computer lenses for your specific glasses. So who's going to benefit from computer lenses? Mostly patients over 40. Most patients under that don't have vision problems. That's painting with a broad brush, but that's pretty accurate. Um, but pretty much anyone who has near vision issues will usually benefit from a computer lens, whether you use reading glasses to read your Kindle at night or the newspaper, or you have a bifocal or a progressive. Anyone whose eyes are tired, their neck is sore, their eyes are dry and gritty, these are all signs of visual strain when using the computer. And it's not because it's a screen you're looking at. It has to do with the way you're using your eyes and focusing on things. I like to say pretty much everyone over 50 is in that category. I know I'm certainly one of them and benefit greatly because I spend so much of my day doing near vision tasks, but at many different distances, that computer lenses have greatly eased my day. What about blue blocking lenses? You hear lots of advertising for those. If you find the screen that with a yellow tint to be more comfortable, whether it's a tint in the lens or you adjust the color of your screen to take out some of the blue, if that makes things more comfortable for you, by all means go ahead and do it. However, the science behind the blue light damaging the eye is extremely lacking. So it's not something you have to worry about from keeping your eyes healthy. It's more a matter if it's more comfortable, I say go for it and either have a blue blocking tint put into your lens or change the monitor. I don't recommend the devices that go over the top of the monitor because they tend to blur and distort things coming off the monitor and make it harder to see them. So it's a 100% fact that computer lenses work better than bifocals or progressive lenses or even single vision lenses for most of my patients. So if you have questions about these, certainly feel free to ask myself during your exam, or any one of my staff members can answer questions also.